Good afternoon again. So today we will continue with the topic of the last lecture, and that was preventive and interceptive orthodontics, and we had discussed about what were the various procedures that fall into the category of preventive orthodontic procedures. And we were discussing about the various procedures, small procedures like caries control, parent and patient education, extraction of retained deciduous teeth, extraction of supernumerary teeth, and others. So extraction of supernumerary, as you can see in this slide, that it is very common mesiodens, which is very commonly present, and it causes the midline diastema. So it needs to be removed as early as possible. As soon as we see it in the oral cavity, it should be removed so that it doesn't go ahead into making it into a permanent problem. Similarly, you can see that there is presence of mandibular first premolar, which is very common. Again, it causes spacing between the teeth, so this should be removed as soon as it is detected in the oral cavity. Occlusal interferences, we have already discussed that it has got a serious effect on the developing maxilla, on the developing temporomandibular joint. Maintenance of tooth shedding timetable is very important. Means it should not be more than 3 months. The difference between the contralateral side should not be more than of shedding, it should not be more than 3 months. If the tooth on one side is exfoliated, it should not, the tooth of the similar tooth of the other side should not be retained more than 3 months. It should be extracted, or it might exfoliate on its own. Other things that should be taken into account is overeaten deciduous teeth roots, unresolved deciduous root fragments, supernumerary tooth, cysts and tumors, overhang restorations. Fibrosis of gingiva is a very common problem, and ankylosed primary teeth. All these things, all these problems should be taken into account as early as possible. Then abnormal frenal attachments, you can see ankyloglossia, lingual frenum, which is very thick, and it is causing the problem to the patient, as well as in the developing process it will cause the improper development of the maxilla, of the mandible, and it might produce the severe malocclusion of the class 2 type. Now there is one more thing that is now very obsolete, but previously it used to cause very great damage to the developing malocclusion, in which there was a disease called as scoliosis, in which there was a bent spinal cord, so which was straightened with the help of some orthopedic apparatus, which gained you can say retention from the maxilla, from the facial region, and that ultimately resulted into the ill effects onto the developing maxilla and the mandible. In other words, it caused retardation of growth of the mandible. So it should be prevented if we are giving Milwaukee brace to the patient. Nowadays these things are obsolete, but they just require some mention from the historical point of view. Nowadays these problems are corrected through surgical means if there is bent spinal cord. So today, in these days, the surgical process is very advanced, and we can correct it without giving these things to the patient. So prevention of this thing was there. Now in details, if we'll start with habits. I have just discussed about habits play a very important role in malocclusion. They should be prevented as early as possible, intercepted as soon as you see them causing damage to the developing dentofacial complex. Buttersworth in the year 1961 has defined a habit as a frequent or constant practice or acquired tendency which has been fixed by frequent repetition. This was a definition that was given by Mr. Buttersworth in the year 1961. The other definition that is my favorite and the easiest definition is, you can define the habit as a learned pattern of muscle contraction of very complex nature. Learned pattern of muscle contraction of a very complex nature. Now coming to the classification, there are different types of classifications that were given by different researchers. The first one that was given by Mr. William James, you can classify them as useful habits, you can classify them as harmful habits. What are the useful habits? For example, nasal breathing. Nasal breathing is again a useful habit. We execute nasal breathing without our own acquaintance. Similarly, deglutition is also a habit. When we chew food, we don't have to think that we have to take it into our gullet. It goes automatically. So these are useful habits which are necessary for your own existence. Harmful habits. These are the habits that we practice unknowingly. For example, tongue thrusting, tongue sussing, and many other habits are there which are directly or indirectly causing damage to your personality, that are causing damage to your general well-being, that are causing damage to your developing dentofacial complex. We are more concerned about the developing dentofacial complex, so we will be limiting ourselves to only those habits which a child exhibits during the growing stage that results into disturbances in the developing dentition. Then there was one more classification that was given by Mr. Morris and Bohana. For example, he categorized them as pressure habits, non-pressure habits, and biting habits. Pressure habits, like they were active in nature, means they provided active pressure onto the developing dentofacial complex, like lip sucking, thumb sucking, and tongue thrusting. Then there were non-pressure habits like mouth breathing, in which there was no active pressure but loss of the normal physiologic balance in the oral cavity that resulted into the development of development of some disturbances in the dentofacial complex. Then there are some biting habits which children often exhibit, like nail biting, pencil biting, lip biting, and other sorts of biting habits. Okay, now there was third classification that was given by Mr. Finn. He classified them as compulsive and non-compulsive habits. Compulsive habits are those habits that are very deep-rooted habits and they have acquired a sort of fixation in the child. Means if you try to remove this habit, the child feels anxiety and it is very difficult to remove such types of habits which are compulsive in nature. Non-compulsive habits are those habits, these are the habits that can be easily learned and dropped as the child matures. So you can classify them as compulsive and non-compulsive habits. Compulsive habit means a very the thumb sucking habit of a very large duration or a very extended duration, it becomes a compulsive habit. A child who is exhibiting the thumb sucking habit since a long time, it is very difficult to remove that habit because it is deep rooted into his psychology, which needs so much amount of practice to remove that particular habit. Then this classification was given by Mr. Clean. You can call it as empty or unintentional habits and meaningful or intentional habits. Means empty habits are those habits that are not associated with the deep-rooted psychological pattern, whereas meaningful or intentional habits are the habits that have got psychological bearings. Now, what are the changes when a person is exhibiting oral habits? What effect it will produce on the developing dentofacial complex? It depends upon these three things, that is intensity, duration, and frequency. With what intensity this particular patient is exhibiting that particular habit, since how much time this person has been exhibiting this particular habit, that is called as duration, and frequency is how many times in a day this person executes this particular harmful habit. So all these factors, they form a particular corpus that results into you can judge that this habit is going to give more damage to the developing dentofacial complex. We all know that these are the various deleterious oral habits like thumb sucking, finger sucking, tongue thrusting habit, mouth breathing habits, lip habits, nail biting, bruxism, broadly. So we will start with the thumb sucking habit. Now, thumb sucking habit, you can say it is not considered to be a habit till 2 years of age. If you see ultrasonographic representation of a pregnant mother, you will see that sometimes you will find the child is sucking his own thumb even when the child has not taken birth. And even after birth, sucking own finger or thumb is not considered as a habit, rather is considered to be a very, very beneficial thing from the psychological point of view by various researchers, and that is true, as Mr. Sigmund Freud has pointed out, that the presence of this habit till the 2 years of age happens to give a more psychological benefit, and how it causes damage to the orofacial structures if it is continued after 3 years of age, that we will discuss in the next lecture. So thank you for listening. Thank you.